Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action. My name is Nina Sun, and I am an associate editor for the SRHM Journal.
Hello, I'm Sundari Ravindran, Senior Editor of Sexual and Reproductive Health Matters Journal. Today we'll be talking about our newest call for papers, one that focuses on a topic as urgent as ever, universal access to abortion care.
Hi everyone, it's great to be here. I'm Emma Pitchforth, Executive Editor of the SRHM Journal. This episode is a chance for us to share more about the thinking behind the call, what we're hoping to achieve, and how you can be involved. Whether you're a researcher, activist, advocate, or someone working in service delivery, we invite you to contribute to this important collection.
Let's begin with some background. Reproductive Health Matters, now Sexual and Reproductive Health Matters, has a long history of publishing work on abortion, and we see it as a cornerstone of sexual and reproductive health and rights. Our journal has consistently foregrounded the issue, drawing on women's lived experiences and recognizing the social, legal, political, and economic dimensions that shape access and experiences, and also the clinical aspects and the technological advances in this area. In fact, abortion was a focus right from the earliest issues of the journal, back when it was known as Reproductive Health Matters. The second issue of the journal was on abortion, and then subsequently in 97, 2002, 2004 and 5, 2008, 2014, 2020, we've looked at how abortion laws affect people's lives, the evolution of medical abortion technology, self-care for abortion, provider attitudes, links between abortion and human rights. And our authors have brought us stories and evidence from across the globe, from Latin America to South Asia, from Eastern Europe to Sub-Saharan Africa. So this new call builds on that legacy, but also responds to the current moment. In December 2024, we launched a special collection titled The Continuing Fight for Abortion Rights, taking stock of the evidence. That collection came about as we watched growing threats to abortion access around the world, including rising conservatism, shrinking civic space, criminalization, and the undermining of legal protection. This collection brought together papers that examined the current state of abortion laws and services, and it also looked at the broader landscape of who is being left behind, what strategies are emerging, and where new questions are being raised. While the collection was rich and diverse, with 31 papers covering 5 themes, it also highlighted significant gaps in knowledge and evidence. For example, there is a paucity of evidence on various marginalized groups, including young adolescents, people living with disabilities, trans persons, migrants, internally displaced persons, and those experiencing armed conflict. We need a better understanding of the health system challenges in providing abortion services, provider perspectives and dilemmas, and while abuse in child delivery has been documented very widely, there's very little on abuse during provision of abortion care. We also need a better representation of experiences from all the regions. Emma will now share how we went about co-creating the call for papers that are meant to address some of these gaps.
Thank you. Yes, we're really proud of how this new call has come together. It hasn't been developed in isolation, but we've worked really with partners, regional experts and advocacy organisations who are working on the ground to identify the priorities for the new issue. We wanted to hear from these partners, what are the pressing issues, what are the gaps that need to be addressed, what kinds of evidence and perspectives are most urgently needed. And these conversations have shaped the scope and structure of the call, ensuring that it's rooted in the lived realities and priorities of those most effective. We're particularly interested in themes such as access in humanitarian settings, so how people can navigate abortion care during displacement crises, digital technology, both as a tool for access and as a site for surveillance. Also, the role of social media, including misinformation, disinformation, and strategies for countering anti-rights narratives. We're interested in self-managed abortion that might include the role of feminist networks and telehealth, the impact of criminalisation, whether that's on individuals, providers, or healthcare systems more broadly. Picking on some of the priorities Sundari mentioned, also interested in intersectional barriers, so especially how gender, race, disability, economic status and migration status affect access. And then finally, always interested as well in methodological innovation in the field too. And we're really keen that we have interdisciplinary papers, so looking forward to receiving work from across disciplines, whether that's public health, anthropology, law, sociology, political studies and beyond. So I just wanted to say a bit about the logistics. The call's open now and we encourage anyone with relevant work, whether it's new research, critical commentary or analysis from advocacy and service delivery to submit. The deadline for submissions is the 31st of August 2025. All the information is available on the SRHM website, including author guidelines and instructions for how to submit. All papers are made available online and open access to the reader. This involves article processing charges, and we're aware that the publishing costs can be a barrier, particularly for authors in low and middle income countries. It's detailed on the website, but the publisher offers waivers or partial waivers for authors from low income countries, and SRHM also has a number of waivers available for article processing charges. And on the call, you'll see that we detail the opportunity to submit an application for SRHM waiver. We've asked that these be in by the 30th of June 2025 so that we can get back to authors in time for them to prepare their papers. Because overall, we really don't want costs to prevent the important work from being published in the journal. So please do contact us. If you're not sure whether your idea fits or if you're looking for guidance, we welcome you to get in touch with the editorial team at any point. We really want this issue to be as inclusive and representative as possible.
So what are we hoping to see through this call? First and foremost, we want to publish work that reflects the diversity of abortion experiences and activism. That means geographic diversity, methodological diversity, representation from marginalized communities across age groups. We're particularly eager to amplify voices that are often left out of academic publishing, including community-based practitioners, activists, advocates, and people with lived experience. We want to hear from service providers whose voices have not been well represented so far. We also hope to see work that pushes the conversation forward, not just documenting the problems, but exploring innovative solutions, new forms of organizing, and transformative approaches to care.
Yes, and it's not just about publishing papers. This is part of a broader project of solidarity. Through this issue, we hope to create space for critical reflection, collaboration and action. This call is also a gesture of support to our colleagues around the world. We want this issue to be a resource for you.
Thank you for joining us for this important conversation. We encourage all of you listening to read the full call for papers on our website at srhm.org, and please share it within your networks.
And if you're thinking about submitting, don't hesitate. Whether your work is academic, activist, legal, or something in between, we'd love to hear from you.
Until next time, take care, and thank you for your continued support to SRHM and the global movement for sexual and reproductive health and rights.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.